किसी और
सर हम
कोलीग
यहाँ
को
पे
भेज।
स्टार्ट करें, वो बीच में ज्वाइन कर लेंगे, एक टीम मेंबर नहीं है बस उनके।
अच्छा, ये साथ साथ क्या कह रहे थे?
इसाक साहब कह रहे थे कि
मेरा
मैं।
ख्याल है बाकी अगर उनके लोग हैं तो वो बाद में ज्वाइन, बाकी तो 2-3 होंगे ना उनके कुलीग
श्योर सर,
डॉक्टर्स।
स्टार्ट करते हैं, स्टार्ट करते
हाँ,
हैं।
प्रोफेसर साहब से पूछ लें जैसे
अच्छा,
अशरफ कह रहे हैं तो।
जी जी,
नहीं सर,
इसाक साहब
आप
है।
डिसाइड करें।
इसाक साहब हैं मौजूद?
इसाक साहब कह रहे
जी
थे मैं
जी हैं।
कनेक्ट हो रहा हूँ।
ठीक है, तो क्या हम बिस्मिल्लाह करें? मेरे ख्याल में हमारे साथ प्रोफेसर हमीद साहब तो मौजूद हैं।
श्योर सर, हम स्टार्ट करते हैं, मेरे ख्याल टीम मेंबर आ भी गए हैं सर।
चलें फिर, आप मुझे ग्रीन सिग्नल दें, विल स्टार्ट, नो
ओके,
प्रॉब्लम।
वी विल बी स्टार्टिंग विद प्रोमो वीडियो।
मैं पहले ये जो है ना।
Are you ready to learn with fun? Brace yourselves for the ultimate test of knowledge in the Cardiac Super League. Witness the clash of giants as 12 formidable teams step into the arena, battling it out for cardiology supremacy. In this exciting collaboration between Wilson's Pharmaceuticals and the Pakistan Cardiac Society, the Cardiac Super League promises intense competition and groundbreaking learning experiences. Stay tuned as the teams showcase their expertise, strategic brilliance, and unwavering determination. Who will emerge as the true champions in cardiology? The main goal of the case-based learning approach is to equip students and healthcare professionals to refine their clinical practice by learning the latest advancements. The Cardiac Super League awaits you, guaranteeing to advance your education. Join us and become part of an incredible journey. Visit our Facebook page or contact us for more information.
Assalamu alaikum everyone, this is Hamza Hussain and welcome to Pakistan Cardiac Society's Cardiac Super League powered by Wilson's Pharmaceutical. Today, Alhamdulillah, we are live for the first quarterfinal of Cardiac Super League, which is between P.I.C Warriors from Peshawar and P.I.M.S Leopards from Islamabad. As you know, we have concluded our group stages, and now from out of 12 teams, 8 teams have qualified for the quarterfinals, and 4 quarterfinals matches will be played between these 8 teams. And from these 8 teams, 4 teams will qualify for the final, subsequently for the final, which will be played in Pakistan Cardiac Society 52nd Cardiacon in November, which is planned at Sakhar. Coming back to the today's match, allow me to introduce today's expert panel. We will be joined by Professor Mohammad Ishaq as an umpire of this first quarter final. And second umpire will be Professor Brigadier Dr. Abdul Hamid Siddiqui. He is Professor of Cardiology at P.I.C and National Institute of Heart Disease, Rawalpindi. And Chairperson of Cardiac Super League, Professor Feroz Mehman has also joined us. He is Professor of Cardiology and Vice Chancellor at University of Modern Sciences, Tanda Mohammed Khan. So today's moderator is Dr. Asher Bilal. He is consultant intervention cardiologist at Karachi Institute of Heart Disease. And I will request Dr. Asher Bilal to please start the further proceeding of this today's first quarterfinal match.
Hamza, is everybody listening to me? हमजा, आवाज आ रही है मेरी? हमजा, आपको मेरी आवाज आ रही है?
जी सर, आपकी आवाज आ रही है।
अच्छा, ठीक है। Okay, first of all, I would like to welcome our elite panel of professors, especially Professor Brigadier Abdul Hamid Siddiqui Saab is with us. He is an associate professor of cardiology at AFIC Rawalpindi, and today he is performing the umpire duty along with Professor Ishaq. We all know that Professor Ishaq with us from the beginning. I would like to welcome to both of them. We are fortunate that we have Professor Feroz Mehman with us. He is a cardiology league president with us, so we would like to welcome him as well. With this, for the teams, as you guys know that today is the first quarter final, so good luck for both teams. The quarterfinal will be played between the P.I.C Warriors, which is a Peshawar Institute of Cardiology, and P.I.M.S Leopards, which is Pakistan Institute of Medical Sciences, Islamabad. Just in the middle, I would like to welcome Professor Jalal Achakzai. He also joined us as a panelist. He's a head cardiology at Ulan Medical Center, Quetta. Welcome, sir. Are both teams ready? P.I.C Warriors and P.I.M.S Leopards?
Yes,
Please.
sir.
Okay. So first of all, I would like to move to P.I.C Warriors. Please introduce your captain and your team members to us.
Assalamu alaikum, sir. My name is Dr. Numan Munir Khan. I'm the captain of Peshawar Institute of Cardiology Warrior team. On my right side is Dr. Haider. On my left side, Dr. Hassan. And on his left side is Dr. Wali.
Thank you very much. Thank you very much, and good luck, Peshawar Warriors. Now, I would like to move towards P.I.M.S Leopards. Please introduce your captain and your team members, please.
Assalamu alaikum. I'm Dr. Muniba Said. I'm the captain of the team, and on my left side is Dr. Maria, and on my right is Dr. Khalil.
Thank you very much, Dr. Saiba. Okay, just want to recap with the game plan. Today's game plan, because it is a knockout game, so initially we will ask 10 questions to each team, and if in case the game is tie, then we will ask another 2 questions to each team from the same topic. And if the game tied again, then we will move towards the super over, in which we will ask 3 questions to each team, but these questions will not related to the initial topics. So they will be the random questions. Is it clear for both teams? Please.
Yes, sir.
Okay, that's fine. Thank you very much. So with this, I would like to move towards Hamza for the coin, electric coin toss. Just can you remove this? Just a minute, guys, please. Yes, thank you. So, and with this, I would like P.I.M.S Leopards to call the toss. P.I.M.S Leopards, it's your turn. You want to head or tail? Please tell us.
Heads.
Okay, Hamza, please toss the coin. Okay, so it's head. P.I.M.S Leopards, you won the toss. Now you have to tell us, you want to bat first, means you want to answer the questions, or you want to ball first? We want
to bat first.
Okay, that's fair enough. So P.I.M.S Leopards choose the batting. Good luck both teams. And P.I.C Warriors, please start your scenario with the questions.
Reading the cover the phone. Blur question
Assalamualaikum.
Walaikum assalam. Sir, there is some issue in the screen.
Yes, sir, we have started.
Started, okay. आपने मुझे कॉल नहीं किया, मैं तो वेट कर रहा था. चलें बिस्मिल्लाह करें.
Yes, sir. Mr. Ramza, there is some issue in the screen reading. Okay.
So, yeah, pleasure to welcome these both teams and introduce करा दिया है.
जी सर. आपका इंट्रोडक्शन भी हो गया था.
Okay. So, कौन अशर बिलाल कर रहा है मॉडरेट?
जी डॉक्टर अशर बिलाल.
चले बिस्मिल्लाह करें.
सर अस्सलाम वालेकुम सर. सॉरी मेरा माइक
म्यूट. ओके
सर, मेरा माइक म्यूट. हाँ सर, मेरा माइक म्यूट था बिकॉज जरा सा सेटिंग्स हम कर रहे थे. We have introduced you and really welcome again, sir. You are the biggest supporter for us for this game. So we are just the exact report is that P.I.M.S Leopards won the toss and they want to bat first. So P.I.C Warriors start asking their questions.
That's fine.
Okay. P.I.C Warriors, please start with your scenario.
Okay, sir. We have some issue in reading the scenario. Mr. Ramza, can you solve it?
Is it not clear in your screen?
Yeah.
Can you please tell what is the issue? Is it blurred or not readable or
yes?
What?
Yes, it is a bit blurred.
I guess we are having an issue of internet from your side.
आप ये कंफर्म कर सकते हैं कि आपने कार्डिक सुपर लीग की स्क्रीन को पिन किया हुआ है, जो कि मैक्सिमाइज हो जाती है स्क्रीन के ऊपर आपके?
जी पेन है।
Okay, so the scenario is a 48 years old male presented in
44 years.
44 years old male presented in your clinic for checkup. He was sitting in a coffee shop around 20 minutes before, when his friend who invited him for coffee told him that he was recently diagnosed with increased blood pressure. His friend told him that he had not any symptoms, and one day he checked his blood pressure at home, which came out to be 187 by 93 mm of Hg. He was very worried, so he came straight to your clinic for checkup. He is not having any symptoms. He walks around 1 hour daily. His BMI is 24.9. He does not drink alcohol, but occasionally he smokes cigarette. His father and mother both are taking medicines for increased blood pressure. Clinical nurse checked his blood pressure. It was 141 by 93 mmHg.
Yes, Hamza, move forward.
जैसे कि फर्स्ट ब्लड प्रेशर किसका था?
किसी का
किसी का था?
अपने घर पे
दोस्त कह रहा था ना कि मेरा है।
So the question number 1 is what should be the next action? Option A is recheck the blood pressure after half an hour because after first reading was taken by staff nurse. Option B, recheck blood pressure after half an hour to make sure that patient is not having white coat hypertension. Option C is recheck blood pressure after half an hour because conditions were not ideal during first reading. Option D, you will advise him for lifestyle modifications because his BMI is a higher range. Option E, you will start him on antihypertensive treatment because he has strong family history of hypertension.
So, P.I.M.S Leopards, your time starts now.
मैं सिनेरियो दोबारा देखना चाहिए। जो फर्स्ट प्रेशर की रीडिंग थी वो
इसकी अपनी थी, इसने घर पे चेक की थी।
We want to see the scenario again.
Okay, Hamza, put the scenario again, but your timer is running on because it's already started.
ब्लड प्रेशर था वो किसका था? नहीं, उसने देखो लिखा हुआ है कि उसको बता रहा है कि बल्कि, और उसने लिखा हुआ है कि he had not symptoms, लेकिन उसने घर पे अपना बीपी चेक किया था कि वो 187/93 था।
क्या क्या रिटायरमेंट बच्चा है ये?
ब्लड प्रेशर है, बट ये हमें आइडियल कंडीशन नहीं है, वो डेफिनेटली हमें उसको करना है। ऑप्शन तो सी है। पर ये कि अगले क्वेश्चंस के लिए भी मैं ये देखना चाह रहा हूँ कि ये 187।
Okay, warrior. Okay, Leopards, 40 seconds left.
We'll go with the
Can we see the question again, please?
Yes, please, Hamza, put the question on the screen. 30 seconds left. Hamza, please put the answers again, options again, please. 20 seconds left. Hamza? Yes, guys. 15 seconds left.
We will go option C.
Okay, should we lock the option C? Please confirm me.
Yes.
Lock. Okay, stop, Hamza. Okay, we're gonna lock the option C. Please lock the option C, Hamza. Oh, very good, mashallah. The first question, you give the right answer. That's very good. Congratulations to P.I.M.S Leopards. With this, I would like to ask P.I.M.S Warriors to bowl their second over. Please ask the second question, Warriors.
The second question is, you checked his blood pressure half hour later because he had coffee within 20 minutes of first reading. His second reading was 147/97 mmHg. You advised him ambulatory blood pressure monitoring. According to AHA, which readings from below will be considered as high blood pressure after 24 hours ABPM? Option A is daytime, more than 135 by more than 85, nighttime, more than 120 by 70, 24 or 48 hours, average more than 130 by more than 80. Daytime awake, more than or equal to 140 systolic, and more than or equal to 85 diastolic. Nighttime asleep, more than or equal to 120 systolic, and more than or equal to 80 diastolic 24 or 48 hours later, with average of more than or equal to 135 systolic and more than or equal to 85 diastolic. Option C is daytime awake, more than or equal to 145 systolic, more than or equal to 95 diastolic, and nighttime more than or equal to 120 by 80, 24 or 48 hours average, more than or equal to 140 by 90. Option D is daytime more than or equal to 140 by 90, and nighttime more than or equal to 130 by 75, 24 to 48 hours, or average of more than or equal to 135 by 85. Option E is daytime more than or equal to 140 by 90, and nighttime more than 130 by 130 by 80, 24 or 48 hours, average of more than 140 by 90.
Okay, P.I.M.S Leopards, your time starts now.
डेट तो याद है कि 135 85 वाला जो था ना वो हाई होता है डे टाइम के लिए
पे 70 है ये मुझे याद है
हाँ और 135 85 की है ठीक है कर लो
मैं 70 75 में कंफ्यूज था मैं ये वाले को देख नहीं रहा हूँ
डे मुझे कंफर्म है 135 पे 85
मैं 80 से कम
80 से कम है
हाँ तो अभी गो विद ए
ए लॉक कर दो
यस
we will go with the option A.
Okay, you still have 60 seconds left. You can take your time and rethink again. It's a quarter-final, so take your time because it's do and die game.
135 तो मुझे याद है कि 135 ही कट ऑफ है डे टाइम सिस्टोलिक का
नाइट टाइम पे 70 इज फाइन 70 75 इन दोनों में से
Okay, so if you guys are sure, we would like we can lock the answer A. Are you sure we should lock the answer A? It's 30 seconds left now.
yes lock answer
Yes.
lock answer A.
Okay, Hamza, stop and lock answer A, Hamza. Very good, fantastic. Very good. With this, you move to score 12. And with this, I would like to ask P.I.C Warriors, please ask your next question, which is question number 3. Yes, P.I.C Warriors.
So the question number 3 is, after 24 hours of ambulatory blood pressure monitoring, it was observed that his readings are higher than normal readings. He is advised to start treatment. He came back after 2 months with swelling of the left knee. On examination, his left knee was swollen and hot. He is in distress due to pain and assuming that this is due to some medicine. Which medicine he is most likely taking? Option A is valsartan, option B is losartan, option C atenolol, option D amlodipine, and option E hydrochlorothiazide.
Okay, P.I.M Slappers, your time starts now.
Answer E.
Okay, okay, very good. I mean, in just 2 seconds time. Are you sure we should lock it?
Yes.
Okay, Hamza, please stop the timer. And they are really 100% sure, so we will gonna lock answer E, option E, please. Fantastic. Once again, you guys doing great. So with this, we're gonna move to question number 4. P.I.C Warriors, please ask your next question.
Question number 4 is, after stopping the drug, his swelling improved. He was started on another drug. He is curious that he was not advised any test before starting the medicines. All of the following tests should be advised in newly diagnosed patient with systemic hypertension except option A is fasting blood glucose, option B is complete blood count, option C is thyroid stimulating hormone, option D is serum uric acid, and option E is urine analysis.
Okay, your time starts now, P.I.M Slappers.
RFTs किडनी फंक्शन के लिए मैसेज के नहीं चल रहा थी बाकी कोर्स करेंगे
वो तो ठीक है
करेंगे यूरिक एसिड करेंगे
यूरिक एसिड कब करते हैं
हाँ
यूरिक एसिड कब करते हैं
उसके लिए
यूरिक एसिड
मेटाबॉलिक सिंड्रोम के लिए
मेटाबॉलिक सिंड्रोम के क्राइटेरिया में यूरिक एसिड नहीं है
उसमें
यूरिक एसिड उसके 5 क्राइटेरियाज में यूरिक एसिड नहीं है
तो ब्लड सीपी क्यों होगा सीपी में तो नहीं है ना
ये करा रहा हूँ, बात करता हूँ, मैं बात नहीं कर सकता, मैं गेम करा रहा हूँ।
बेसलाइन लैब सारी करानी होती है
बेसलाइन करवानी है लेकिन सीपी का डायरेक्ट कोई इंटरेक्शन नहीं है यूरिक एसिड का ताल्लुक है यूरिक एसिड इज अ रिस्क फैक्टर
नहीं यूरिक एसिड करके देख लें सही कह रही हैं बीएलएल सो होती है
देखिए यूरिक एसिड तो उसमें बढ़ भी गया है ना हाइड्रोक्लोरोथायराइड भी तो यूज किया है आई फील सीपी इज राइट आंसर
Okay, P.I.M Slappers, 40 seconds left.
सीपी
सीपी
कर लें लेकिन मुझे इस पे डाउट है
आप क्या कहती हैं
Okay, 30 seconds left, P.I.M Slappers.
इंडिकेशन आपने बेसलाइन कुछ वर्ड ही
नहीं कर
ऑप्शन बी
Option, sorry?
बीटा कंप्लीट ब्लड काउंट
Okay, okay. Stop, Hamza, please. Stop the timer and lock option B. Please lock option B. Oh, wrong answer. Okay, no problem. Better luck next time. Okay, with this, we will gonna move towards our 5th over. P.I.C Warriors, please ask.
So the question number 5 is, he came after a week with record of blood.
Yes, guys, please concentrate on the next question because it's limited time. Yes, ask the question number 5, please. P.I.C Warriors. Hello. I think we lost the connection with the P.I.C. warriors. Can you just hide the screen?
Is 3 to 6 months.
Hello?
So they have
हाँ?
read the question, I guess. I don't know if
Yeah.
PIMS have.
हाँ, हमें आवाज नहीं आ रही थी हमजा इनकी.
P.I.C. warriors are requested to please again read the question number 5.
Okay, so the question number 5 is that he came after a week with record of his blood pressure monitoring at home. His blood pressure is now controlled. He is not having any symptoms. He started regular walk and aiming to reduce his weight. According to AHA guidelines, his next assessment should be after. Option A is 1 to 2 weeks. Option B is 2 to 4 weeks. Option C is 1 to 2 months. Option D is 2 to 3 months. And option E is 3 to 6 months.
2 to 3.
Okay, your time starts now, P.I.M.S. Leopards.
3
I think 3 months.
1 month का तो नहीं कट ऑफ मतलब 3 monthly after
First तो है 6 week फॉलो करते हैं लेकिन later on आपने मतलब आपने 1 to 3 month करना है उसको.
ये तो फर्स्ट वीक भी हो गया ना.
इसने तो सिम्टम आ गई खत्म हो गया.
या 1 month पे कर ले 1 to 2 month पे कर ले.
2 month
गाइडलाइंस पूछ रहा है वो उसकी पेशेंट
गाइडलाइंस नहीं पढ़ी मैंने.
नहीं पड़ी ना. बताएं क्या करें. गाइडलाइंस.
Okay, 50 seconds left, P.I.M.S. Leopards.
Yeah.
मैं कह रहा हूँ कि ये कर लेते हैं ना.
1 to 2 months. C. Option C.
Okay, you still have 35 seconds left, Leopards. You want to think again?
C कर लेते हैं. Option C. मुझे पिछले का.
Okay, so you want me to lock the option C? Yes. Would you like to lock the option C? Leopards?
Yes.
Okay, Hamza, please lock the option C. Lock the option C, 1 to 2 months. Oh, bad luck, bad luck. Now, Hamza, here I would like to stop for a second. I just want to welcome Professor Javed Al-Barsayal. He joined us. He is a professor at National Institute of Cardiovascular Disease, Karachi. Please, very welcome to Professor Javed Al-Barsayal.
Thank you very much.
Okay, thank you, Professor Saab. With your permission, we would like to continue, proceed our game, and P.I.M.S. Warrior, please ask your next question.
Please go ahead, please. Thank you.
The question number 6 is patient came back after 6 months for follow-up in OPD. He is doing fine. He reduced his BMI to 21 now. He is taking his medicines regularly. You advised him to continue his medicines. He wants to discuss something regarding some renal denervation therapy. He said that he read on internet that by this therapy, his blood pressure will be completely cured. What will you tell him about this therapy? Option A, it's very effective in completely curing of systemic hypertension. Option B, there is strong evidence with multiple randomized controlled trials that it will be a promising therapy in patients with resistant hypertension. Option C, there are small trials on this therapy and evidence is very poor. Option D, the results are promising but more evidence is required. And option E, the trials are in very initial phase.
Okay, with this, P.I.M.S. Leopards, your time starts now.
अब तो इन्होंने क्लास 3 कर दिया इसको. हाँ.
इसमें तो क्लास 3 का कंप्लीट स्ट्रांग एविडेंस.
पूरा एविडेंस ही होगा ना 3 का.
पहला तो गलत है, इफेक्टिव नहीं है और आरसीटीज भी सपोर्ट नहीं कर रहे इसको, ये भी गलत है. रिजल्ट्स आर प्रॉमिसिंग बट मोर एविडेंस इज रिक्वायर्ड. इसका सी.
ऑप्शन सी.
क्योंकि अभी ये है कि जो रेजिस्टेंट है, रेजिस्टेंट में भी एंड पे जाके अगर किसी को कुछ नहीं कर रहा तो फिर आप इसके बारे में सोच सकते हो, वरना इसकी रिकमेंडेशन खत्म है.
Okay, 45 seconds left. P.I.M.S. Leopards.
Option C.
Okay, are you sure we should lock option number C?
Yes.
Okay, Hamza, please stop here and lock option C. Oh, sorry, bad luck. Good luck next time, P.I.M.S. Leopards. With this, we would like to ask warriors, please ask your next question.
Question number 7 is, after 6 months when you were doing duty in ER, same patient presented with history of left-sided weakness. Your neurology colleague was managing him when he called you to evaluate him regarding blood pressure control. On inquiry, neurology resident told you that his blood pressure is 190 by 110 mmHg. CT scan revealed intracerebral hemorrhage. What will you advise him? Option A, start IV labetalol to reduce the blood pressure up to 140 by 90 in next 24 hours. Or option B is start IV labetalol to reduce 15% BP in next 24 hours. Option C, no need to reduce blood pressure and monitor closely. Option D is start on IV nitroprusside to reduce the BP up to 140 by 90 in over next 24 hours. And option E is start on IV nitroprusside to reduce 15% BP in the next 24 hours.
Okay, with this P.I.M.S, Leopard, your time starts now.
Labetalol देते हैं, nitroprusside तो नहीं.
Last
15% in 24 hours. BP अपने लेगी.
करना है इसको.
लेकिन 15% होना चाहिए, B होना चाहिए.
140 by 90 नहीं करना, तो 140 by 90 आपने करना है OT dissection में, pre-eclampsia में, और नहीं, OT dissection, pre-eclampsia और तीसरी एक और चीज थी. बस आपने 180 पर उससे नीचे लेकर आना है. 180 हाँ, 180 by 105 से नीचे लेकर आना है.
P.I.M.S Leopard, your 45 seconds left now.
मुझे 140 करना है, प्लीज. लैब कंटेंट करना है.
Okay, 30 seconds left.
I think option A.
मुझे बीटा लग रहा है.
कर देंगे.
बीटा.
20 seconds left.
Option B.
Leopards. Option B for beta. Are you sure?
Yes.
Okay, yes. Hamza, please stop the timer and log option B. Oh, bad luck. Anyway, that's fine. Good try. With this, we will move towards question number 8. P.I.C warriors, ask your next question.
Question number 8 is the patient record from stroke. You visited him in neurology ward to inquire regarding his health. He told you that he was doing fine when someone told that there is an alternate therapy by some Hakim by which his blood pressure will be cured completely. So he stopped medicines and started on herbal therapy. You search his file and you notice his creatinine is 2.7, which was normal in the initial evaluation. What will be the ideal target of blood pressure in this patient now? Option A is 140 by 90. Option B is 135 by 85. Option C is 130 by 80. Option D 125 by 75. And option E is 120 by 80.
Your time starts now, Leopards.
130, 80 है ना, diabetes, CKD और उन सब के साथ. नहीं, कोई एक चीज भी.
है ना, CKD.
बाद में 125
नहीं, जिस ऐप में मैंने पढ़ा 120, 130. Option C.
Okay, are you sure?
Yes.
Because you have plenty of time now, still 60 seconds left. You want me to block your option?
Yes.
Okay, Hamza, lock the option C, please. Very good, fantastic, right answer. Okay, with this, you P.I.M.S Leopards move towards score 18, and with this, we're gonna move towards question number 9, which is the second last question. Yes, P.I.C warriors, ask your second last question.
The question number 9 is, patient is very concerned about his renal function tests now. He asked you that, is there any medicine which can slow down the disease progression? You told him that you will check guidelines for this. According to AHA, ACE inhibitor has class 2A indication in patients of CKD with option A, CKD and albuminuria more than or equal to 300 mg per day or more than or equal to 300 mg per gram of creatinine. Option B is CKD and no albuminuria. Option C is CKD and albuminuria more than or equal to 200 mg per day or more than or equal to 200 mg per gram of creatinine. Option D is the ARBs are preferred over ACE inhibitors, and option E is none of the above.
Okay, Leopards, your time starts now.
सब में नहीं देते
25% बढ़ता है तो फिर हम इसको stop करते हैं।
नहीं 25% तो एक्सपेक्टेड होता है, लेकिन मैक्रोएल्ब्यूमिन जो होता है ना, जिसमें 300 से ज्यादा होता है उसमें उसमें फायदा है। 300 से ज्यादा
ये ज्यादा कुछ भी हो सकता है।
हाँ, तो प्रोटीन यूरिया में तो फायदेमंद है ना,
हाँ,
तो उसमें तो इतने देने हैं, एक बन रहा है ना।
तो
200 वाला तो कट ऑफ ही नहीं है, 30 का या 300
बी
का।
डी और ई तो है ही नहीं।
ऑप्शन ए।
Okay, Leopards, are you sure? You still have 55 seconds left.
Yes.
Okay, Hamza, please lock option A. Please lock option A. Very good, fantastic, right answer. Okay, that's fine. With this, Leopards, your score moves to 30. And with this, we will gonna move towards the last question of first inning. So, Warriors, please ask your final question.
Question number 10 is, unfortunately, patient's creatinine worsened despite therapy. He was disappointed and quit all sort of therapy. A year later, same patient presented in OPD with referral from nephrology for renal transplant workup. His blood pressure is 160/90 despite 3 drugs. He has NYHA class 3 dyspnea. Which factors in this patient are important in considering perioperative risk according to revised cardiac risk index? Option A is blood pressure and serum creatinine. Option B is his age and history of CVA. Option C, increased creatinine and history of CVA. Option D, history of CVA and blood pressure. And option E, NYHA class 3 dyspnea and serum creatinine.
Okay, your time starts now.
हाँ वो सॉरी सी है ना, इंक्रीज क्रिएटिनिन और हिस्ट्री ऑफ सीवी। ऑप्शन सी।
Okay, are you sure? Because you still have 75 seconds left. Take your time, relax. That's my suggestion is.
ब्लड प्रेशर का नहीं है, उसका जो है ना वो है डायबिटीज, इंसुलिन है। गिव अस 1 मिनट विद इंसुलिन है, ठीक है।
No, you have 55 seconds. We cannot give you 1 minute.
ओके बीपी वाला तो नहीं है, ठीक है। एज भी है, ठीक है। क्रिएटिनिन तो मोर देन 1.5 है,
स्ट्रोक है
और स्ट्रोक है। आई विल गो विद ऑप्शन सी।
40 seconds left. Okay, P.I.M.S Leopards, are you sure? Are you sure we should lock option C? You still have 30 seconds left.
Yes.
So should we lock? Should we go ahead?
Take the,
Yes.
Should we go
take
ahead?
the answer.
Okay.
Choice this.
Okay, that's fine. Okay, that's fine. Hamza, please lock option C. Lock option C. Very good, fantastic. Okay, so it's the right answer. With this, okay. With this, with this, P.I.M.S Leopards, you scored 36 runs. Its first inning is over, and I would like to get this opportunity to welcome Professor Fawad Farooq. He joined us as well. So we would like to welcome Professor Fawad Farooq. He is a professor at National Institute of Cardiovascular Diseases.
Thank you, Asher, for introducing me. Really exciting to see both team. Half of the match is over, so first inning, and let's see what's happened in the second inning. And it's quarter-final, so the winner is going to take part in semi-finals.
Yes, I think we are just moving with the Asia Cup as well, because next week there will be a semi-finals and finals in the Asia Cup as well. Okay, with this, I just would like to ask Brigadier Abdul Hamid Siddiqui Saab, just give him some valuable comments for the game which proceed up till now. Professor Brigadier Abdul Hamid Siddiqui Saab.
I think the P.I.M.S has team just quite good, although they have dropped a few questions. But I think the scenario was very practical. The thing that we come across in our daily practice. So good luck for the next team for this competition. I think they have a good margin to win in this competition because they have just scored 36 runs. So good luck for them.
Thank you very much, Brigadier Abdul Hamid Siddiqui Saab. With this, I would just like to have a short comments from Professor Feroz Mehman Saab. Sir, please give your input as well for the game till now.
Thank you very much, Asher. You are doing a wonderful job, a very good, excellent moderation. I think you are keeping both the teams very comfortable.
Thank you very much.
Being an immediately participant in Pakistan Hypertension League, I revised my hypertension just now. Every question was very tricky, and it was had a very narrow therapeutic range to give the correct answer. I think the team has done very well, and I appreciate them. And thank you very much for making me part of this program. It's a wonderful program. Thank you so much.
Thank you very much. Thank you very much, sir. It's our privilege that you were with us. Similarly, just a short comment from Professor Javed Akbar Sayal as well, because we have a lot of panelists and the colleagues today. So we will ask Javed Akbar Sayal to give him some short comment. Thank you, Professor.
Thank you very much, Asher. I have already experience of being a panelist in some of your games and definitely enjoying a lot and refreshing my knowledge. Though, as Professor Feroz said, that therapeutic index is very narrow, so it's very difficult even for me to answer these questions. But anyway, this is a great activity of Wilson Pharma, and probably it is enhancing its beauty and attraction day by day. So thank you making me part of this, and definitely Pakistan Cardiac Society is behind this whole program. Thank you very much.
Thank you, Dr. Javed Akbar Sayal, for your valuable comments. And with this, I think both teams have a good enough rest. Are you guys ready for the next round? Please, P.I.M.S, Leopards and P.I.C Warriors, are you guys ready for the next round, next inning?
Yes, sir.
Yes.
Okay, that's fine. So P.I.M.S Leopards, it's your turn to ask the questions. So please put your scenario and start asking your questions.
Yeah.
Yes, please read out the scenario.
Okay, 26-year-old female, Gravida 2 Para 1, presented in the OPD with history of left lower limb swelling for the last 1 month. She does not have any history of
last
OPD
1 week. Sorry, Dr. Sabah. Last 1 week.
Last 1 week, sorry. She does not have any history of OCP use. She had bilateral lower limb swelling, which is just mild since first trimester, but this swelling of left lower limb is obviously big. She is comfortable otherwise, but worried about this swelling because her mother had also this issue in her pregnancy, and she ended up in ICU on the breathing machine. One of your junior colleagues is thinking that she got DVT, but he is not sure. He tried to calculate probability of DVT in the in this patient.
In this patient, yes. Yes, Hamza, please move the screen forward. Hamza, move the screen forward, please. Yes, so it's question number 1. Please ask the question number 1.
Which one of the below is not included in the modified Wells score? A, family history of DVT. B, previous history of DVT. C, entire leg swelling. D, active cancer. E, alternate diagnosis is at least as likely as DVT.
Okay, Warriors, your time starts now.
तो क्या हुआ?
आपको स्क्रीन नजर नहीं आ रही वॉरियर्स? Hamza, please hold the timer. Warriors, please reply me. Hamza, hold the timer, please.
Yes, sir. Yes, sir.
Warriors, आपको स्क्रीन नजर आ रही है?
Yes, sir. Yes, sir.
Okay, Hamza, continue with the timer, please.
Sir, we will go with the option A, family history of DVT.
Okay, it's your final thought?
Yes, sir.
Okay, Hamza, please stop the timer and lock the option A, family history of DVT. Very good, fantastic. So you start with the bang, huh? Good luck for the future. Good luck for the future game. So P.I.M.S Leopard, you can ask your second question now. Yes, please read out the question.
Which one from below is not very helpful in making a diagnosis of DVT in this patient? Venous Doppler of lower limb, modified Wells criteria, pregnancy as a predisposing factor in this patient. Option D, D-dimers level. E, unilateral cough swelling.
Okay, warriors, your time starts now.
Sir, we will go with the option D, the D-dimer levels.
Okay, this is your final thought. Should I lock it?
Yes, sir.
Okay, that's fine. Hamza, please stop the timer and lock option D. Lock option D.
Sir, option D, D for Delta?
Yes, D for Delta. D for Delta, D-dimer levels. Yes.
Yes, sir.
Okay, right answer. Congratulations again to warriors.
Thank you, sir. Thank you, sir.
P.I.M.S, please move towards your over number 3.
A diagnosis of extensive DVT is made by venous Doppler, but problem arises as patient is in second trimester. Your consultant asks to consult guideline regarding the appropriate treatment regime in this patient. According to guidelines, which drug you would prefer to treat DVT in this patient? A, direct thrombin inhibitor. B, direct factor 10 inhibitor. C, VKA. D, low molecular weight heparin. E, aspirin.
Okay, your time starts now, warriors.
Sir, we will go with the option D, low molecular weight heparin.
Okay, no second thought?
Yes, sir. Low molecular weight heparin is the final
Okay,
answer.
that's fine. That's fine. Hamza, please stop the timer and lock option D, please. Lock option D. Very good. Congratulations again. It was the right answer. Okay, with this we will gonna move towards question number 4. Please, Leopards, ask your next question.
Please maximize the screen.
Your colleague
Hamza,
support.
Yes, Hamza, please maximize the screen for them. Okay, that's fine. Please proceed, P.I.M.S Leopards.
Your colleague supported your choice of low molecular weight heparin to treat DVT in this patient, but he worried regarding one thing with use of low molecular weight heparin. He said that low molecular weight heparin activity should be monitored during pregnancy with anti-factor 10 levels. You agree because A, serum concentration of enoxaparin in pregnancy is altered by increased excretion of low molecular weight heparin. Option B is serum concentration of enoxaparin in pregnancy is altered by decreased absorption through the skin. C, serum concentration of enoxaparin in pregnancy is altered serum protein levels which bind enoxaparin during pregnancy. Option D, serum concentration of enoxaparin in pregnancy is altered by fetal protein levels which bind enoxaparin during pregnancy. E, none of above.
Okay, your time starts now, warriors. Okay, warriors, 49 seconds left. 30 seconds left. 30 seconds left, warrior. Yes, warriors. 19 seconds left. Almost 15 seconds left now.
We will go with the option C. Serum concentration of an
Okay, that's fair. Okay, that's fair enough. Stop the timer, please. Hamza, stop the timer and lock option C. Very good, fantastic. Right answer. Good. Okay, good luck for the next questions to both teams. And with this, we will gonna move towards question number 5. Yes, P.I.M.S. Leopards, ask your next question.
Patient is very worried because she read post-thrombotic syndrome on Google. Following are the characteristic of post-thrombotic syndrome except A. Damage to valves of deep vein system. B. Venous microangiopathy. C. Higher levels of inflammatory markers. D. Varicose vein formation. E. Vascular compression stockings can prevent it.
Okay, your time starts now.
सर टाइमर के दौरान दूसरी टीम हमें नजर नहीं आ रही होती
हमें नजर आ रही है वो आपस में डिस्कस कर रहे हैं Okay, Hamza, please try to show the other team to them.
P.I.C. warriors are requested to please keep their mic close to their mouth before while formulating the answer.
आप warriors please आप अपना माइक अपने करीब कर लीजिए ताकि आपका डिस्कशन सब सुने. The अगली टीम जो है वो worried है.
ठीक है.
Okay, now 35 seconds left, warrior. 30 seconds left, warriors.
Post-thrombotic syndrome except vascular compression stopping.
Okay, now 20 seconds left, warrior.
Sir, our answer is
10 seconds left.
vascular, option E. Vascular compression.
Okay, stop the timer. Stop the timer and lock option E. Right answer. Very good. Fantastic. Okay. So with this, almost 3/4 of the game is finished. Again, good luck to both teams. And with this, we will move towards question number 6. P.I.M.S. Leopards, please ask the next question.
Patient was doing well, but unfortunately, she developed sudden shortness of breath on third day of admission. You are suspecting pulmonary embolism, but you are not sure which diagnostic modality should be preferred in pregnancy. Which of one of the following is true? A. CTPA is not a good choice because it is harmful to baby at this stage. B. VQ scan is not preferable because it is harmful for the mother at this stage. C. Conventional angiography is reasonably safe in pregnancy. D. Patient should have X-ray. If it comes out to be normal, then VQ scan should be the first choice. E. Patient should have X-ray. If it comes out to be abnormal, then CTPA scan should be the first choice. Yeah.
Okay, your time starts now, warriors.
Normally, we are much CTPA sara mother breast tissue is like VQ cancer fetal the whole C to the angiography. Patient could have X-ray if it will be normal. CTPA be contrast. X-ray excuse the radiation level. Na belly cover red shielding high risk
Sir, our answer is option D. D for doctor.
Okay, are you sure your answer is D?
Yes, sir. Patient should X-ray. If it comes out normal, then VQ.
Okay, Hamza, please stop the timer and lock option D. D for Delta. Very good, fantastic. Right question, right answer. So with this, we're gonna move towards question number 7. Please ask question number 7. Leopards, P.I.M.S. Leopards, please ask question number 7.
Patient is not well. Her heart rate is 112 per minute, blood pressure is 97/63, and SpO2 is 89% on room air. Your senior suggested to use thrombolytic therapy for patient, but you want to risk stratify her before going for thrombolytic therapy. You have heard about P.I.C criteria but it's difficult to remember score. You use simplified P.I.C based on patient's clinical data. What is her risk index? A, low risk, B, moderate risk, C, high risk, D, clinical data in question is not enough, or E, none of the above.
Okay, your time starts now. Option D is the clinical data in question is not sufficient enough.
Borderline there, say. Pregnancy cause है. Option C, D, मतलब दो चीजों में बाकी थी तेरी कि दो चीजों में दिया. Pregnancy पे दवा. अच्छा से यार करने के कार्डिया कर ले बीपी कर ले पूरा clinical data clinical
Simplified PC type age initially 28 age
Celorum clinical data is not such. मत बताओ like यार. ना दा होना दे. मत हो तो moderate होने के. Celorum like ना high risk.
Okay, 35 seconds left. Warriors, 35 seconds left. 30 seconds left, Warrior.
Sir, we will go with the option D. Clinical data in question is not sufficient enough.
Okay, are you sure we should lock the option D?
Yes, sir.
Okay, Hamza, please stop the timer and lock option D. Oh, that's good. So with this, both teams have the same score, and with this, we will gonna move towards next question, which is question number 8. So, P.I.M.S. Leopards, ask your next question. Good luck, both teams.
You performed bedside echo and you noticed that RV is dilated with raised EPASP. House officer and ward already sent cardiac markers when patient developed shortness of breath and markers came out to be raised. Which of the following factors increases in hospital mortality in this patient? A, blood pressure, B, heart rate, C, pulmonary artery pressure of 70, D, dilated RV, E, raised cardiac markers.
Okay, your time starts now. Warriors, your time starts now. Okay, Warriors, 40 seconds left.
Sir, our answer is option B, heart rate.
Okay, it's your final thought?
Yes, sir.
Okay, Hamza, please hold the timer and lock option B. Oh. Okay, no problem. Still, both teams have same runs. And with this, we will gonna move toward the second last question, which is question number 9. Good luck, both teams.
Thank you, sir.
Okay. Please move towards question number 9.
Based on simplified P.I.C, you manage patient successfully with thrombolytic therapy, and she is out of danger now. Patient is very grateful, but that you saved her life. She is curious that is there any possibility that she can use injections in her next pregnancy right from start? What will be your best answer? A. She must have prophylaxis right from the start of her next pregnancy. B. As she does not have a clear predisposing condition for DVT in pregnancy, data is not very clear whether she should have prophylaxis or not in the next pregnancy. Option C. She must have a genetic test to rule out any genetic predisposition for venous thromboembolism in case if she want to have next pregnancy because her mother had also same issue. Option D, compression stocking in the next pregnancy would be enough to prevent her from DVT. Option E, aspirin would be enough in her next pregnancy. There is nothing to worry.
Okay, your time starts now, warriors. Yes, warriors, please close, make the mic close.
Okay, sir. Our answer is option C. She must have genetic test.
Okay, are you sure? Because they still have plenty of time, and
yes,
this
sir.
is. So should I lock it?
Yes, sir.
Okay, Hamza. Good luck, both teams. Stop the timer and lock option C. Oh. Okay. So we'll move towards the final question. Game reached to the final over again. I think we are playing the game between India and Pakistan. The same situation will gonna happen in the evening as well. So okay, everybody gets, tighten your seat belts and ready for the final over. So Leopards, ask your final over or deliver your final over, please. So would you like to start with Shaheen Afridi?
Yes, sir.
Okay, go ahead.
You discharged patient on low molecular weight heparin for the rest of pregnancy. Patient later on admitted in the ops ward with labor pains.
Obstetric
on
ward.
call, obstetric ward with labor pains. PGR on call generated a call for cardiology because she wants to give patient epidural analgesia, but patient had last injection of low molecular weight heparin 12 hours ago. What would you suggest? A. Epidural anesthesia can be given comfortably. B. Ideally, epidural anesthesia should be avoided within 24 hours of last injection of low molecular weight heparin. Option C. Once epidural catheter inserted, it is safe to resume anticoagulation within 2 hours. Option D. Once epidural catheter is removed, it is safe to start anticoagulation within 6 hours. Option E, B, and D.
Okay, warriors, your time starts now. हमजा आपको पसीने आ गए?
Yes, sir.
दिल की धड़कनें तेज हैं?
Exactly.
Okay, you have 60 seconds left. Take your time. So last ball and 6 runs required, huh?
Okay, sir. We will go with option A.
Okay, this is your final answer?
Yes, sir.
Okay, Hamza. Stop the timer and lock option A. Oh, fantastic. Okay. So, P.I.M.S Leopards, good luck. Good luck, both teams. You finally managed to survive the game, huh? Okay. Now we can see the smiling face in P.I.M.S Leopards, huh? Okay, that's fine. I would like to move toward Professor Jalal Achakzai. Just need your comment, sir, about the game, which is the game which is happened till now. So it's to Professor Jalal Achakzai. Guys, please keep quiet because guys, please mute your mics because Professor Jalal Achakzai will gonna say some words about the game up till now. Yes, Professor Saab.
For inviting me. I really enjoyed. Congratulations to you for excellent performance, being a good moderator, and both teams really.
Thank you very much.
I think here India, Pakistan were playing, and their P.I.M.S and P.I.C were fighting, and it was a well-fought match. Both the team did very well. I think the pehla session tha, especially blood pressure. The guidelines, there were really impressive guidelines. Questions, the questions really were even tougher for me when I was thinking to reply those questions. I think very well formulated the questions, and both the teams have cooked up well for this competition. Full marks to P.I.M.S, full marks to P.I.C. So the final thing is the fight has, I think, both the teams have scored equal.
Yes. So the way forward is that we will gonna ask two questions to each team. It is a sudden death game. If somebody asks drop the answer or give us the wrong answer, then the other team will win. If they both came equal in this round, then we'll move towards the third round. In this round, we will ask the questions from the same scenario, which both team already have it before. So, with the permission of Professor Isaaf Saab, sir, are you with us? Professor Isaaf? Okay. So, with the permission of Professor Javed Akbar Syal Saab, should we move forward, Dr. Javed Saab?
Yes, Dr. Asar, please go ahead.
Okay, that's fine. Thank you. So, Hamza, please put the two questions. Okay. So, Hamza, should we need to toss again, or I think we will play with the same scenario which we used to play in the cricket. So, I think it will be P.I.C Warriors who will answer the questions first, isn't it? Now, we will P.I.C Warriors, you will answer the question first, and P.I.M.S Leopards, you will ask the questions now. Okay, so each team will ask two questions. So P.I.M.S Leopards, please, you can ask your two questions first. Hamza, please put their questions.
Sir, we will be having one question each, and it will be a sudden death situation. Team answering the wrong question will be.
Yes, that's what I said. Maximum we will ask two questions from the same scenario, and if both teams are equal in this round, then we will see what we're gonna do for the future. So yes. Yes,
Okay.
P.I.M.S Leopards ask the 11 question number 11.
Patient delivered per vaginally and
I think.
Sorry, yes, Hamza.
Okay, please continue. Sorry.
Format 10, sir.
patient delivered per vaginally and there are no complications during perioperative period. Patient is very keen to stop anticoagulation. Should I continue?
Yes, you should continue. Yes.
Okay. Patient delivered per vaginally and there are no complications during perioperative period. Patient is very keen to stop anticoagulation. What would be your advice regarding anticoagulation? A. No need for anticoagulation as after delivery, as risk for DVT falls abruptly in postpartum period. B. Treatment should be continued for at least 4 weeks after delivery. C. Treatment should be continued for at least 6 weeks after delivery. D. Treatment should be continued for at least 8 weeks after delivery. E. Compression stockings are enough for DVT prophylaxis.
Okay, your time starts now. Yes, P.I.C Warriors. मेरा नाम लेके कह रहा हूँ बिजी है We would like to welcome Professor Ishaq Sahab again with us. Sir, very welcome again. Sir, आपका mic mute है.
Okay, sir. Our answer is option C. Treatment
I
should be
think we are
continued
approaching
for
the
at
end
least
of
6
the
weeks.
session.
Okay. So Hamza, hold the timer here. Okay, warriors. So your final answer is C. Am I right?
Yes, sir. Yes, sir.
Okay, Hamza. Lock the option C. Right answer. Okay. Now what we will gonna do here, warriors and leopards, please listen to me. Now, warriors, you will ask the next question. Okay.
Okay,
So
sir.
if the leopards give the right answer, then we will move forward. If the answer is wrong, then you will be the winner. Okay. So this will be the scenario now. So
Okay,
Hamza, please. Yes, sir. No, it's a sudden death game now, sir. Both games equal, draw, tied, and a sudden death now. So Hamza, please put the question which P.I.C. Warrior asked to P.I.M.S. Leopards.
Scenario will be the same as it was in P.I.C. case, and this will be the 11th question from this scenario.
Yes, please.
As question is the risk of perioperative MI is high in this patient, what will be the next strategy in this patient? Option A is take high risk concern and proceed with transplant. Option B is get echocardiography. If there are segmental wall motion abnormalities, go for core angio before surgery. Option C, as the risk is high, core angio must be done regardless of echocardiography results. Option D, pharmacological stress testing is recommended test in this patient. And option E is none of the above.
Okay, Hamza, don't start timer now. Hold the timer now. Leopards, do you want to see the scenario again? Because it's been long time. You want to see the scenario again? Leopards.
We want to see the question number 10 again.
10? No. We cannot show you the question number 10. We want to show you the scenario, the first scenario. You want to see that scenario? We cannot show you the last question. We cannot show you the last question. Do you want to see the scenario? Yeah, we will put the scenario, initial scenario with you. Put the initial scenario to them because it's been a long time.
Ashar, if I don't see you, I would like to congratulate both the teams and thank you for moderating it.
Sir, we kept you for the last. We want your comments in the last, sir. You know, you are the special person for us. Can you just give us 5-10 minutes, sir? Professor Ishaq.
I think we should move to our questions.
Yes, please move towards the question now and start timers now. Yes, move towards the question and start timer now.
Ashar, I have got another meeting to do, so मेरी तरफ से सबको compensate कर देना.
Okay, sir. Thank you. As you like, sir. Thank you very much, sir.
डायरेक्टली प्रोसीड कर दें टू द ट्रांसप्लांट। दूसरा ये कि फार्माकोलॉजिकल जो आपके हाई रिस्क पेशेंट्स होते हैं ना, उनमें हमने आगे मेटाबॉलिक वो देखना होता है, मेट्स को देखने होते हैं। अगर मेट्स कम हो तो फिर हम स्ट्रेस टेस्टिंग करते हैं।
Okay, 60 seconds left. Leopards.
हाँ। तो आपने जब इस सर्जरी पे जाना है तो पहले वैसे उधर जाने एंजियोग्राफी करके देखिए।
एंजियोग्राफी नहीं करते, स्ट्रेस टेस्टिंग पहले रिकमेंडेड है। चलें देखो, लेकिन ये है कि अगर आपके मेट्स अच्छे हों,
स्ट्रेस टेस्टिंग
हाँ ठीक है, फिर
दे सकते हैं।
ठीक है, फिर डी करें।
Okay, 40 seconds left. Leopards.
तो फार्माकोलॉजिकल स्ट्रेस करें।
ऑप्शन डी।
Okay, you still have 30 seconds left. Should I lock it?
स्ट्रोक हुआ है तो वो फिर फिर
फार्माकोलॉजिकल है ना।
Yes, 20 seconds left. Please give me your final answer.
D for doctor.
Sorry?
D for doctor.
Okay, Hamza. Okay, Hamza. Stop the timer and lock option number D, and see where we are. Oh. Okay. So we are now in the same position now. Okay. Hamza, so we will gonna ask the question number 12 to both teams now. It's really getting very excited now. So,
should we continue with P.I.C case or should we?
Yes. P.I.C Warriors will ask the question now.
Okay.
P.I.C Warriors, ask your last question now.
Patients came back a day later with ABPM report, ambulatory blood pressure monitoring report. There are certain terms which he reads on ambulatory blood pressure monitoring. Correctly match the following terms with adjacent columns. Option A, white coat hypertension. Sorry, sir, we cannot read the screen as it's a bit blurred.
Okay, I will read it down for you. So, white coat hypertension, and here it's written number 1, white coat reaction superimposed on a middle level of out of office hypertension. Now you can see. Warriors, can you see now? Warriors, can you see?
Yes sir, लेकिन
हमने इस पे करना क्या?
नहीं, क्वेश्चन समझ में नहीं आया हमें.
Okay, मैं आपको बताता हूँ. ये थोड़ा सा ट्रिकी क्वेश्चन है. We have discussed with this. We thought कि हम यहाँ तक नहीं पहुँचेंगे, but we finally reach here. ये एक्चुअली जो हमारा सिनेरियो उस तरह से बेस्ड नहीं है. ये एक्चुअली जो है ना वो चूज द बेस्ट द मैचिंग क्वेश्चन टाइप का क्वेश्चन है. अब इसमें आपने ये करना है कि जो भी आपके 5 ऑप्शंस हैं 1 2 3 4 5, उनको जो रोमन 5 हैं 1 2 3 4 5 उनको मैच करना है उनके साथ. I think 60 seconds is less for this question. 90 seconds less, so we can give you another 30 seconds, for 2 minutes for this question. So
नहीं सर, जो आप कह रहे हैं कि जो इधर 1 2 3
के साथ ऑप्शन फॉर एग्जांपल ऑप्शन ए को हम काउंट करते हैं तो 1.
हाँ, मैं आपको दोबारा ये बेसिकली मैचिंग क्वेश्चन है. इसमें आपको व्हाइट कोट हाइपरटेंशन जो नंबर 1 है उसके साथ जो रोमन में 1 2 3 4 5 है उनमें से कौन सा स्टेटमेंट जाएगा वो आपको, तो नीचे आपको सारे ऑप्शन दिए हुए हैं A B C D, आपको इनमें से चूज करना है कि कौन से उसके साथ जाएंगे. ठीक हो गया? You got my point?
5 questions.
Okay, we'll do it inshallah.
I mean that's why I said कि मैं आपको जो है इसमें थोड़ा ज्यादा टाइम देता हूँ. आप इस क्वेश्चन को पढ़ लीजिए, क्योंकि ये थोड़ा ये बात हुई थी मेरी हमजा से. दिस इज एक्चुअली जो है ना हमारे सिनेरियो से जरा डिफरेंट क्वेश्चन है.
ये देख लें.
या फिर लेपर्ड्स एक काम और कर सकते हैं. हम इसको यहाँ पे खत्म कर देते हैं. हमारे पास 3 क्वेश्चंस हैं जो कि किसी भी उससे रिलेटेड नहीं है. इफ यू वांट वी कैन स्टार्ट दैट सिनेरियो. उसमें कोई
we can take it up 30 seconds और देते हैं.
Sure.
Yes.
Okay, Hamza, start the timer now. Just a minute. Hamza, इसको स्क्रीन को Warriors, are you happy with it? Warriors, are you happy with it?
हमने ऑप्शन भी तो नहीं पढ़े, को ऑप्शन पढ़े हमें टाइम भी ना दें कोई. We'll do it.
Yes, आप स्क्रीन से हटाइए. Warriors, are you happy with it? Okay, yes. That's fine. Start timer now.
सारे ऑप्शंस अभी तक नहीं पढ़ेंगे सारे.
अच्छा, स्टॉप करें, टाइमर को स्टॉप कर दें.
क्वेश्चन पढ़ देना फिर उसके बाद.
ठीक है, आप क्वेश्चन पढ़ दीजिए प्लीज.
सर एक्चुअली इस तरह है कि क्वेश्चन काफी टाइम से स्क्रीन पर है ऑलरेडी, तो इस टाइम में हमने मतलब क्वेश्चन हमारा नहीं है, हमने भी काफी सारा पढ़ लिया है अभी, तो हमें भी कुछ जवाब समझ आ गए हैं. तो लिटरली ज्यादा मिल गए ऑलरेडी. तो
अच्छा हमजा
हम हैप्पी नहीं है सर इसको फिर नेक्स्ट.
अच्छा जस्ट अ मिनट हमजा यहाँ पे होल्ड कर दीजिए. आई एम गोइंग टू मूव टुवर्ड्स अंपायर व्हिच इज ब्रिगेडियर अब्दुल हमीद सद्दीकी साहब.
काइंडली क्वेश्चन अगर स्क्रीन से हटा सकते हैं तो बेहतर रहेगा सर.
हमजा हटा दे. हमजा अब मेरी सजेशन ये है कि हम इसको रहने देते हैं. ये मेरी हम्बल सजेशन है. और जो 3 डिफरेंट क्वेश्चंस हैं उनको पूछ लेते हैं, क्योंकि ये क्वेश्चन बहुत ही ज्यादा जो है ना वो हमारे जो पैटर्न है उससे डिफरेंट है. बाकी मैं ब्रिगेडियर साहब से एडवाइस ले लेता हूँ जैसे वो सजेस्ट करें.
नहीं, मेरा ख्याल है कि अगर ये क्वेश्चन जैसे अभी डिस्प्ले हो रहा है तो दूसरी टीम के लिए भी फिर ऐसा ही क्वेश्चन मैचिंग वाला होना चाहिए.
नहीं, मेरा ख्याल है ऐसा नहीं है.
हाँ,
ऐसा नहीं है, इसलिए मुश्किल है.
फिर वो बेखल फिर दोनों टीम के लिए it would be unfair for one team and
ठीक है थैंक यू वेरी मच सर आई गॉट योर पॉइंट हमजा इसको ऑफ कर दीजिए दोनों क्वेश्चंस को और जो तीन क्वेश्चंस हैं फ्रॉम द डिफरेंट सिनेरियो वो ले लीजिए मेरे ख्याल में फवाद आर यू विद अस डॉक्टर फवाद नहीं ओके देखिए ये प्रेफर ये क्योंकि जो है ना दोनों के साथ जो है ना वो बेहतर नहीं होगा कि हम इस तरह का क्वेश्चन पूछे मेरा भी यही सजेशन है हमजा आप प्लीज जो तीन आपके बैंक में क्वेश्चंस पड़े हुए हैं वो वन बाय वन पूछ लेते हैं उसमें देखते हैं क्या क्या रहता है
सर we will be sharing two scenarios and these two scenarios will be having three questions and three questions will be asked from the both teams.
Two scenarios or no? Two scenarios or three scenarios?
Two separate scenarios with three questions.
Okay. So, which team would like to give the answer first?
So I think we should move towards toss.
Okay. We should move towards toss again. Okay. So this time the call will be for the PIC Warriors. PIC Warriors will gonna start toss. You have to call. Okay. Yes, okay. Hamza, please toss again.
वो करेंगे
Yes, you want head or tail? Okay, head. Hamza, please toss the coin.
वो एक कर जाकर तो भी इतना चला
Leopards, please mute your mic because we are getting disturbed with this. Okay, tail. So Leopards win the toss. Leopards, you win the toss. Leopards, open your mic, please. You win the toss.
Would like to answer first.
Okay, that's fine. So PIC Warriors, you have to ask the questions first.
Okay, sir.
Okay, Hamza, please put the questions now. Quickly, Hamza, we are really getting late now.
पहले तीन सर पहले तीन
यस वॉरियर्स जो है वो क्वेश्चन पूछेंगे और लेपर्ड्स आंसर देंगे
इस तरह है सर या हम आंसर देंगे
नहीं लेपर्ड्स आंसर देंगे क्योंकि वो टॉस जीत गए आप टॉस हार गए तो चॉइस उनकी होगी
सो वी विल आस्क द क्वेश्चंस एंड दे विल आंसर
यस आप क्वेश्चन पूछेंगे और वो आंसर देंगे
ओके सर
यस वॉरियर्स प्लीज आस्क द सिनेरियो.
So the question is, the differential diagnosis of pulmonary embolism is challenging. PE should be considered in the different diagnosis of patients suspected of having cardiac ischemia, heart failure, COPD exacerbation, pneumothorax, pneumonia, sepsis, acute chest syndrome in patients with sickle cell disease, and acute anxiety with hyperventilation.
So ask your first question now, please. 4 years.
The question is, which of the following is preferred imaging technique for diagnosing acute pulmonary embolism? Option A is V by Q scans. Option B, duplex ultrasonography. Option C, CT angiography. And option D, echocardiography.
Okay, your time starts now, Leopards.
Option C.
Okay, are you sure we should lock the option?
Yes.
Okay, stop the timer, Hamza, and lock option C. Very good, fantastic. Okay, just a minute. I want to hold here. Hamza, should we ask all three questions to Leopard first and then move towards Warrior?
I guess all three questions first.
Okay, that's fine. Okay, Leopards, please ask the second question.
So the second question is, which of the following is highly sensitive for predicting the absence of PE and is used for the patients whose probability of PE is unlikely and who may need only minimal additional testing?
Yes, please ask the option. Please read out the options.
Option A is V by Q scanning. Option B is D-dimer testing. Option C is CT angio, and option D is duplex ultrasonography.
Okay, your timer starts now.
Sensitive is ruled out now. If D-dimer is negative, if D-dimer is
high specificity
is sensitive, not specific. Specificity permanent है. Sensitive D-dimer. I will go with D-dimer suspect.
ये देखो बहुत तो वैसे
sensitive has not.
देखो स्पेसिफिसिटी क्या होती है कि अगर नेगेटिव आ गया तो रूल आउट होगा.
No, अगर पॉजिटिव आ गया तो पॉजिटिव है, दैट इज स्पेसिफिक। अगर नेगेटिव आ गया तो इसमें डिजीज नहीं है, दैट इज सेंसिटिविटी। सेंसिटिविटी
Okay,
सेंसिटिव
55 seconds left,
Sensitivity
leopards.
rule in के लिए होती है।
सेंसिटिविटी रूल उसके लिए होती है ना।
Sensitivity rule in के लिए
अगर
होती
एक
है।
चीज बहुत कम सेंसिटिव होगी तो वो तो नहीं डिटेक्ट कर पाएगी। आई विल गो विद डी डाइमर्स। डी डाइमर पहले करेंगे, अगर वो नेगेटिव है तो वी वोंट गो फॉर परमेबिलिटी।
मिनिमल करनी है ना, मिनिमल टेस्टिंग, ठीक है।
additional
इट इज
testing.
यूज फॉर पेशेंट्स हुज प्रोबेबिलिटी फॉर पी इज अनलाइकली,
ऑप्शन बी।
तो फिर तो हम
डी डाइमर।
हाँ
Okay, 30
Option B.
seconds left.
Option beta.
Option B.
Yes.
Option. Okay, okay. Hamza, please stop the timer and lock option B. Okay, right answer. Very good. Fantastic, warriors. Now, fantastic, leopards. So with this, we will move towards the last question. P.I.C. warriors, please ask your last question. Now I can see the smiling face on leopard's pavilion. Yes. Hello. Hamza, where is the teams now?
The P.I.C. warrior is disconnected.
चेक करें आप वहां पे अपनी लोकल टीम के साथ क्या हुआ है।
हाँ जी।
हमजा, आप आपके कोई कुलीग अगर वहां हैं उनके साथ तो उनसे फोन पे चेक कीजिए क्या मसला है। हमजा आ रही है? जी जी।
व्हाट्सएप पे कौन?
Yes, they are back now.
Okay, they are back.
Yes. So P.I.C. warriors, you can ask your last and final question now.
What was the result?
Hamza, please show the question on. Yes, warriors. Yes, warriors, we can hear you.
Okay, the question number 3 is the oral factor 10A inhibitor anticoagulants can be used for both initial and maintenance anticoagulation therapy. These drugs are more convenient than warfarin because they have fixed dosing and do not need laboratory monitoring of their anticoagulation effect. Which of the following is the major disadvantage of these drugs? Option A, virtually any new drug prescribed may cause an interaction with these maintenance drugs. Option B, there are no widely used drugs to reverse anticoagulation if bleeding occurs. Option C, these drugs can induce necrosis in the patients with heparin-induced thrombocytopenia. And option D, clinically relevant bleeding in studies was higher with edoxaban, a factor Xa inhibitor, than with warfarin.
Okay, their voice is dropping now. Your time starts now, leopards.
यूज नेक्रोसिस पेशेंट वो वाली बात नहीं है, तो डिटेल यूज करने ये नहीं यूज करने डिटेल यूज करना है, तो आई विल गो विद वाइडली यूज्ड नहीं है, वो अभी कुछ आ रहे हैं मार्केट में बट अवेलेबल नहीं है।
ठीक है।
The connections are getting worse, you know, from both sides.
Actually, any new तो नहीं है।
नहीं वो तो नहीं बात नहीं, तो गो विद ऑप्शन बी।
Any new drug that has any interaction with these drugs.
बी असली नहीं है, ए भी नहीं है, बी बचता है, ऑप्शन ई है ही नहीं। ऑप्शन ई तो नहीं है, ये 4 ऑप्शंस है हमारे पास। ये नो,
ये 4 ऑप्शंस हैं, प्लीज। There are 4 options, please.
Right.
Beta. We will go with beta.
Okay, Hamza, stop the timer and lock option B. Okay, right answer. Very good, fantastic. So you answer your all 3 questions. Now, warriors, it's your turn to answer the questions. P.I.M.S, leopards, please ask your scenario and questions.
अभी भी नहीं बता, हम जीतेंगे नहीं। हाँ, क्योंकि उससे
गेम हो गई।
Yes, please. We are getting late, so please.
A 49-year-old man
Read
with
out.
hypertension. A 49-year-old man with hypertension presents to the emergency department with 6 hours of severe substernal chest pain. The initial ECG shows 1 mm ST elevation in lead V1 to V4. He continues to have 6/10 chest discomfort despite nitroglycerine and morphine. On physical examination, his BP is 110/60 with a pulse of 95 beats per minute. An S3 is present with rails halfway up both lung fields. The monitor shows 210 beats run of non-sustained VT at 160 beats per minute. The patient is started on lidocaine. What would be the next step in the management of this patient?
Okay, ask question number 1, please. Ask your question number 1, please.
What would be the next step in the management of this patient? A. Immediate catheterization and possible PCI. B. IV beta blocker and IV Lasix with medical therapy. C. IA BP insertion with medical management. D. Pulmonary artery catheter insertion with medical management.
Okay, your time starts now, warriors.
Sir, we will go with the option A, immediate catheterization and possible PCI.
Okay, are you sure we should lock the option A?
Yes, sir.
Okay, hold the timer, Hamza, and lock option A. Okay, very good. Right answer. Okay, with this, we're gonna move towards the second question. Please ask the second question. Leopards, ask the second question, please.
Which of the following is associated with highest risk of cardiovascular mortality after primary PCI? A. TIMI-3 flow grade with normal myocardial blush perfusion grade. B. Transient no reflow. C. Persistent tachycardia. D. TIMI-1 TIMI-1 myocardial perfusion grade.
Okay, your time starts now. Okay, 60 seconds left. Warrior, 60 seconds left.
Okay, sir, we will go with the option D, TIMI-1 myocardial perfusion grade.
Okay, so your final answer?
Yes, sir.
Okay, Hamza, stop the timer and lock option D. Hamza, stop the timer and lock option D. Okay, it's the right answer. Okay. Now we will gonna move towards the final question. Leopards, please ask the final question.
At the time of discharge, his echo shows EF of ejection fraction of 35%. Which of the following drugs should be added in addition to DAPT, statin, and beta blockers? A. Long-acting nitrates. B. Eplerenone. C. Trimetazidine. D. Rizulazine.
Sir, we will go with the option B, eplerenone.
Are you sure we should lock option B?
Yes, sir. Option B.
Okay. Okay. Stop the timer and lock option B. Hamza, stop the timer and lock option B.
So what to do next, sir?
3 more questions.
Okay. So still the game is tie.
Should we move towards 3 more questions each?
We don't have 3 more questions.
We do have 3 more questions.
Hamza, Hamza, do you have 3 more questions?
Yes. I think we should continue with P.I.M.S with the same case, with 3 more questions.
I think we should ask one question now, answer and that.
Okay. Yes, I think. Yes, whoever gave the wrong answer, the khalas.
Yes.
Okay? It should be the sudden death now. So 1 question with each. This time it was answering Warriors were answering. Now, so the Warriors will ask the question first, and Leopards will answer, and similarly we go ahead with this. Okay. So first question we're gonna. Yeah, Warriors will ask the question, and Leopard will answer.
Okay, sir.
One question each. One question each. Okay. Warriors, you should ask the question now. Hamza, put the question on the screen, please.
Following is a high-risk feature of pulmonary embolism: heart rate more than 100 BPM, or B, systolic blood pressure less than 100, or respiratory rate more than 24, or arterial oxygen saturation less than 95.
Yeah, your time starts now. Yes, Leopards.
Saturation तो ठीक है ना, respiratory rate का कोई रोल नहीं है, heart rate तो more than 100 होता है significant, लेकिन सबसे important चीज तो blood pressure होती है. ठीक है, कर दो. We will go with option B.
Are you sure?
Yes.
Okay, Hamza, lock option B. Okay, right answer. That's fine. Now, Leopards, you will ask the question to Warriors, please. Hamza, put the question.
Never died.
Which of the following among P2Y12 inhibitor is most associated with drug resistance? A, clopidogrel; B, ticagrelor; C, pressagrel; D, canagrelor.
Okay, your time starts now.
Our answer is option A, clopidogrel.
Okay, right. Stop the timer and lock option A. Hamza, I think you guys choose the very basic questions. I mean, next time choose the difficult questions, for these scenarios. It's a very basic question. That's why both teams are giving the right answers. Okay, Hamza. Next time, if you want to choose the questions for, with the tie game, choose the difficult questions. Okay. Okay, now, so Warriors, it's your turn to ask the question now. Second question.
Question number 5 is regarding chronic thromboembolic pulmonary hypertension. One of the following is true. Option A, there is a matched perfusion defect on VQ scan. Option B, estimated systolic pulmonary artery pressure is more than 60 mmHg. Option C, when dyspnea or functional limitation does not persist in the clinical course after PE. Option D, permanent intravascular devices, malignancy, and essential thrombocytopenia are not risk factors for CTEPH.
Okay, your time starts now, Leopards.
Dr. Asher, till they reply this question, the good news is Virat has lost his wicket.
Virat lost the wicket? Oh,
Virat clean bowled by Shaheen Afridi. So was Sharma.
Yes. Virat is out.
Option B is best.
Yes, sir. Congratulations to you. Congratulations to you, sir. I think Virat and Rohit both has gone on 24 runs.
Yeah.
40 से ज़्यादा.
That's good news.
Okay, 40 seconds left, please.
मैच वीक तो हो नहीं सकता, वो भी कहता है, ठीक है, और क्लिनिकल कोर्स में पल्मोनरी के बाद डिस्निया और बहुत रिस्क.
Guys, 30 seconds left. 30 seconds left.
More than 16 कट ऑफ नहीं है.
कट ऑफ नहीं है, बट
40 से ज़्यादा.
ट्रू तो है.
ट्रू तो है.
ठीक है. इट्स नॉट कट ऑफ, इसमें एस्टिमेटेड
नहीं जल्दी बोल.
एस्टिमेटेड दिखाओ बाकी सारे.
Okay, now 15 seconds left.
Beta. Go with beta.
I'll go with beta.
B. Your answer is B.
Beta.
Okay,
B,
stop the
B.
timer. Okay, stop timer and lock option B. Right answer. Okay, now Leopards ask the second question to Warriors.
जीत के नहीं जाएंगे भाई, सजा.
Okay, you can ask the second question to Warriors, please. Hamza, put the question. Hamza, कोई तो निकाल अपनी उम्र यार की जंबील से कोई बेहतर क्वेश्चन निकाल यार।
Regarding NSTEMI, which of the following is not true? Aspirin should be continued indefinitely in all NSTE ACS patients at a daily dose of 325 milligram. All eligible patients with NSTE ACS should be referred to cardiac rehabilitation program. A P2Y12 receptor inhibitor should be continued for at least 12 months. Folic acid should not be used for secondary prevention in NSTE ACS patients.
Okay, our time starts now. Yes or yes? Wow.
Sir, our answer is option A. Aspirin should be continued indefinitely in RNST ACS.
Okay,
at a
that's
daily
fine.
dose of 325.
Okay. Wait. Okay, just stop the timer and lock option A, please. Hamza, lock option A. Okay, Hamza. Now both team asked the right answers for 2 questions, so it's now last 1 questions left, isn't it, Hamza? Or will we exercise all the questions? Hamza.
Sir, we
Hamza,
do
are you
have all
sleeping?
questions. No, I'm waking, sir. I'm waking.
Yes, Hamza. We finished with all the questions?
No, we do have a question, sir.
Okay, then put the question on the screen, Hamza. इससे पहले कि ये तीसरा आउट करें यार और मैं छोड़ के चला जाऊं, ये गेम जल्दी से पूछ ले यार।
एक ऑप्शन ये है कि इसको रीडू कर लें विद शॉर्ट।
हमजा तीन आउट हो गए।
Acha. Sir, we have 2 senior persons with us, Dr. Professor Jalal and Professor Abdul Hamid Siddiqui. Can we ask them to ask questions from both the teams? Is it possible?
Oh, okay, that's fine. Professor Abdul Hamid Saab, is it okay with you that you and Professor Jalal can ask 1 question to each team, and we will finish this game because it's a knockout. Somebody has to win the game.
मेरा ख्याल है कि क्योंकि फॉर्मेट आपका रिटर्न वाला है ना, तो अभी इसमें वर्बल वाइवा।
सर, मैं एक क्वेश्चन पूछ सकता हूँ लेपर्ड से कि ये बताइए अब तक शाहीन आफरीदी ने कितने ओवरों में कितने रन देके कितनी विकेटें ली हैं इंडिया की? जल्दी से बताइए कितने ओवर किए हैं शाहीन आफरीदी ने, कितनी गेंदें की हैं शाहीन आफरीदी ने? जल्दी नहीं, चेक करके नहीं 1 2 3
3.5 ओवर में 2 विकेट ले ली।
टाइम इज ओवर।
It's joking. नहीं, guys, it's joking. I'm joking. It's not the right way. I'm just joking. Okay, Hamza, अगर yes, Professor अचक साहब, आपके कमेंट्स, आप कुछ कहना चाहेंगे?
I think डॉक्टर अशर, आई थिंक जो फाइट रही है बहुत अच्छी रही है, दोनों टीमों ने बहुत अच्छा वो किया। थोड़ी सी चीज जो लैग कर रही है, आई थिंक ऑन बिहाफ ऑफ यू गाइस, you should always think कि ये competition at the end of the match can end up in a draw. तो draw के बाद आपके पास जो बैंक होना चाहिए, और बैंक में इस तरह से नहीं होना चाहिए जिस तरह से अभी हो रहा है। I think we are missing that part.
You're right.
तो अब अगर आप थोड़ा सा
जलाल जैसे कह रहे हैं,
let me
yes please go ahead जलाल।
एक पॉसिबिलिटी है कि इसको आप फिर रीडू कर लें नेक्स्ट टाइम विद शॉर्ट, मीन 10 की बजाय 5 क्वेश्चन वाला, और उसको इसका कर सकते हैं रीडू, क्योंकि जरा अब हम शायद बैंक खत्म हो गया है ज़रा, नहीं ये ऑप्शन 3 के पास।
यस सर, मेरा भी ये ख्याल है। दूसरा जलाल प्रोफेसर साहब, हाँ, ये जो यानी जब ड्रॉ हो जाता है तो उसके बाद के जो क्वेश्चंस हैं वो ये बैंक से लेकर आते हैं हमजा, वो मेरे भी अरेंज नहीं है, तो मुझे भी उनके बारे में नहीं पता। वो क्वेश्चंस का स्टैंडर्ड भी आज मेरा ख्याल है कि स्लाइटली लोअर था, क्योंकि इनिशियल क्वेश्चंस का स्टैंडर्ड था। तो मेरा यही ख्याल है कि हम 5-5 क्वेश्चंस या 4-4 क्वेश्चंस कर लेते हैं। हम ये करेंगे कि जो नेक्स्ट हमारा गेम है, नेक्स्ट जो क्वार्टर फाइनल है, उससे आधे घंटे पहले हम जमा हो जाते हैं, या 1 घंटे पहले हमजा, ठीक है हमजा, उससे 1 घंटे पहले जमा हो जाते हैं। नेक्स्ट जो हमारा क्वार्टर फाइनल है नेक्स्ट सैटरडे को, और उसमें छोटा सा सिनेरियो हमजा उसमें अरेंज कीजिए 5-5 क्वेश्चंस का। और क्योंकि दोनों टीमों को जो है वो प्रेफर्ड यानी ये दोनों टीमों को जो है वो परफेक्ट चांस मिलना चाहिए, इक्वल चांस मिलना चाहिए। ये तो खैर मजाक की बात थी जो मैंने हाँ
जी अशर, मैं इसमें एक चीज बोलूं, जो लास्ट में भी आप कह रहे हैं कि या मैं या प्रोफेसर मीर साहब कोई क्वेश्चन इसमें कर ले, वी कैन पुट देम क्वेश्चन राइट नाउ, चीजें कुछ बायस हो जाएंगी। अब गाइडलाइंस में लेटेस्ट टीएससी नई गाइडलाइंस में उसमें अगर हम क्वेश्चन करते हैं, आई कैन give you the scenario right now, like we can put questions, so does Professor Hamid, लेकिन चीजें कुछ biased हो जाएंगी कि एक क्वेश्चन इजी आया दूसरा इस तरह से। आई थिंक ये चीज होनी नहीं चाहिए, because right now I can put couple of questions to both the team, अगर उस पे आप डिसीजन करते हैं, जो चीज जो टीम जीतेगी प्रॉब्ली दूसरी टीम कहेगी कि हमसे थोड़ा मुश्किल क्वेश्चन पूछा गया, so it would be, I feel, unfair on the part of the teams from us to put them question. Otherwise I've got many questions right now.
Yes, I'm totally agreed with you कि ये रहेगा, और फिर क्योंकि उसको प्रूव करने के लिए सारी बातें आपके पास फॉरेन से लिटरेचर मौजूद नहीं है, अगर कोई क्वेश्चन रेज करता है उस पर, तो आई एग्री विद यू हमजा। हम सब का अब तो फिर डिसीजन यही है कि इसको ना 1 घंटा पहले या आधा घंटा पहले आप दोनों टीमों को इन्फॉर्म कर दीजिएगा नेक्स्ट वीक, या अगर आप फ्राइडे को रखना चाहते हैं, 1 दिन पहले रखना चाहते हैं नेक्स्ट क्वार्टर फाइनल से पहले, तो वो आप इन दोनों को इन्फॉर्म करके हमें इन्फॉर्म कर दीजिएगा। ठीक है हमजा?
Okay, Saturday will be more appropriate, but I will discuss with both teams.
Yes, and I think you should discuss with Professor Isaaq साहब as well कि गेम जो है वो ड्रॉ हुआ है और इस तरह से सिनेरियो है सर, तो हम उसको फ्राइडे रखें या सैटरडे रखें, दोनों टीमों को वेल इन्फॉर्म कीजिएगा, एटलीस्ट 24 आवर्स बिफोर द गेम इन्फॉर्म कर दीजिएगा ताकि वो रेडी रहें गेम के लिए। ठीक है?
श्योर सर, श्योर। ओके
विद दिस कंटेस्ट को थोड़ा शॉर्ट रखने के लिए सॉरी, थोड़ी सी सजेशन, अगर इसको थोड़ा मैच को मुख्तसर रखने के लिए 5 क्वेश्चन आप लोग रख लें किसी भी दिन पे, उस पे डिसाइड कर ले, दैट वुड बी इजी।
5 बेहतर है।
यस सर, हम यही कर रहे हैं, पूरे 10 क्वेश्चंस नहीं करेंगे, जब भी हमने 1 घंटा आधा घंटा या 1 घंटा पहले इसलिए रख रहे हैं कि ताकि अगर उसमें कोई इशू आ जाए तो जो नेक्स्ट जो ओरिजिनल गेम है उस पर कोई असर ना पड़े, ताकि हमारे पास आधे घंटे का गैप मौजूद हो। तो इनको इसीलिए उस टाइम से 1 बजे बुला लेंगे 2 बजे की जगह, ताकि एडजस्टमेंट में और सारी चीजों में थोड़ा टाइम लग जाता है बहुत बार। तो ठीक है हमजा, यू कैन सॉर्ट इट आउट दिस। हमजा, आर यू लिसनिंग टू मी?
Yes sir, I'm listening to you.
Okay, with this I would like to thank you for both teams, and special thanks to Professor Abdul Hamid Siddiqui साहब, and special thanks to Jalal Achakzai साहब कि आप दोनों हमारे साथ आखिरी वक्त तक जुड़े रहे। And from my side, sir, just a small comment from Professor Jalal Achakzai साहब, and then Professor Hamid साहब, Brigadier Hamid साहब, the final comments, and then we will off for today.
I think already Dr. Asher, we have taken already a lot of time. Most would be towards the clinic or their engagement, and plus a good match going on with Pakistan and India. So people, I think, would be eager to be there. It was a good overall fought. Both the teams delivered their best performances. Congratulations to P.I.C. Congratulations to P.I.M.S. You both the teams were well cooked up, well prepared, and you fought well. And so was the moderator. So it was good fight, and best of luck for the upcoming decision-making phase. Thank you.
Thank you very much. With this, I just move shortly to Brigadier Abdul Hamid Siddiqui sir.
Full marks to both the team for nail-biting finish, which is still not finished, and good luck for next time.
Thank you very much. With this, Hamza, I would like to see you off as well. Good luck both team for next time. See you guys from my side as well. Assalamu alaikum.
Yes sir, thank you.
Allah Hafiz, thank you.